All right, let's dive into one of the most exciting shifts happening in modern science, artificial intelligence in medicine. And I want you to stop thinking about AI as just some piece of software. No, it's getting a major promotion. It's becoming a crucial new member of your healthcare team. So let me just ask you this. What if your doctor had a partner that could see everything, remember everything, and process information at like this speed of light? Well, that's the future we're stepping into. This is where AI becomes a core healthcare partner. For years, AI has been this helpful tool, kind of humming away in the background, but that is changing, and it's changing fast. We're watching this evolution happen right now, from a simple utility to a frontline clinical teammate. So, what does this new job description actually entail? Okay, first up, AI's role as a super-powered diagnostician. And let's be really clear, this isn't about replacing doctors. Not at all. It's about giving them a much more complete picture of our health than was ever possible before. This really illustrates that partnership perfectly. A human specialist brings incredible, deep expertise in one specific area, right? The AI, though, it integrates everything. We're talking CT scans, lab results, clinical notes, even your heart rate data, and it synthesizes it all. It's connecting dots that could otherwise be missed, providing a way more comprehensive picture. So, moving from diagnosis to discovery, AI isn't just identifying diseases anymore. It's helping to invent the cures. Its next job is as a brilliant research partner, and it's fundamentally changing how we discover new medicines. Think about it. Finding a new drug can traditionally take a decade and cost billions of dollars. Generative AI is changing that whole game. First, it screens billions of potential molecules almost instantly. Then, it predicts which ones will actually work inside the human body. And finally, it refines those molecules to make them safer and more effective. And this is not science fiction. Frameworks like PURE, which helps predict molecular structures, are already creating real, viable drug candidates with incredible efficiency. The crucial takeaway here is that this accelerates the entire pipeline, getting life-saving treatments to patients way faster and at a much lower cost. So from designing new drugs, let's go even deeper, right down to the very code of life itself. AI is now an absolutely essential tool for decoding our genetic secrets and understanding the fundamental causes of disease. A great example of this is a tool called AlphaGenome. It focuses on the 98% of our DNA that doesn't code for proteins, what people used to dismiss as junk DNA. AlphaGenome analyzes this genetic dark matter to see how tiny little mutations can flip genes on or off and potentially trigger really complex diseases. The potential impact here is it's enormous. By understanding these genetic switches, we could unlock brand new insights into our most challenging conditions. Everything from cancers to autoimmune disorders like lupus and MS. This is a fundamentally new level of biological understanding. And finally, let's look at AI's role in changing where we receive care. It's helping to literally break down the walls of the hospital, bringing sophisticated medical support directly into our homes. This is all happening through what are called virtual care ecosystems. These AI-powered platforms can use sensors to monitor patients continuously, automatically triage who needs urgent attention, and provide telehealth support. It's making remote care a totally mainstream, high-quality option. This quote really captures the entire story perfectly. AI is moving way beyond just a simple advisory role. It's becoming an active clinical teammate, blending data from your smartwatch, your medical history, and powerful new reasoning to become a true partner in your care. So this brings us to the big question, right? We've seen AI as a diagnostician, a drug inventor, a genetic decoder, and a remote caregiver. As this powerful partnership between human expertise and artificial intelligence gets even deeper, what will the future of medicine ultimately look like?